Hello, my name is Nathan Wong, and I am Editor-in-Chief of the new Cardiometabolic Disease Clinical Community, which is now available on CardioSource. Today I'm talking with Dr. David Wood, who is the Garfield Weston Professor of Cardiovascular Medicine at the Imperial College in London, on the topic of the EUROSPIRE 4 survey, its implications and findings. Welcome, Dr. Wood.
Thank you very much. It's a pleasure to join you.
So the EUROSPIRE surveys on risk factor control and adherence to recommended secondary prevention therapies in patients with coronary disease have been conducted 4 times since the 1990s and have really been an important contributor to our knowledge about cardiovascular care in the European region and how it varies across countries. Recently released at the European Society of Cardiology were some of the findings of the EUROSPIRE 4 survey. Dr. Wood, can you tell us first a little bit about the design of this particular phase of the study and what was unique about it compared to earlier EUROSPIRE surveys?
So EUROSPIRE is a classical cross-sectional survey of patients with coronary disease are interviewed and examined to assess the extent to which their lifestyle and risk to management and use of drug therapies meet the standards set in our European guidelines. And they have been conducted, as you say, over on 4 occasions over the last 14 years. And that's provided us with unique insight into time trends in coronary patients being cared for.
So now, in particular, you found some striking findings related to obesity and diabetes, especially across the different regions studied. Can you elaborate on this?
Yes, we saw some serious adverse trends in both obesity and central obesity, which have increased significantly across this 14-year period. And in the wake of this increase in obesity and central obesity, we see a corresponding increase in the prevalence of diabetes. And of course, the development of diabetes increases the risk of microvascular disease, recurrent macrovascular disease, and shortens life expectancy. So this is a worrying trend. And in the most recent survey, we did a formal oral glucose tolerance test on all patients with coronary disease who did not report that they had diabetes. And we found that only a minority, about a third, were truly normoglycemic. The rest had impaired fasting glycemia or impaired glucose tolerance or undetected diabetes. So actually a majority of the coronary patient population, as we have studied recently, has some form of dysglycemia or diabetes, either new diabetes or self-reported. And this represents a very serious challenge in terms of helping these patients to modify their lifestyle.
And how about with respect to current cigarette smoking and efforts in smoking cessation, David?
So here the results are disappointing because we found that about half of all of those patients who were smoking at the time of their hospitalization were still smoking at the time we interviewed them a year or so later. So these persistent smokers, the prevalence has remained the same over the 14 years. There's been no change at all. And what is particularly interesting is that actually the use of pharmacotherapies, which we know from randomized controlled trials help patients to break with this addiction, were not used to any greater extent in the most recent survey compared to the earlier surveys. And so cardiologists really need to engage with this very important risk factor, which will shorten the life expectancy of their patients, and particularly given that persistent smoking is highest amongst the younger patients under the age of 50 years, who have most to gain from breaking with this habit.
Finally, you have some unique data with respect to patients being prescribed advice to attend cardiac rehabilitation programs and perhaps some encouraging adherence to this, and curious whether this is better than what we're getting in the United States. What is the level of success across the different European countries that you've seen, and what do you attribute this to?
Well, about half of all the coronary patients are advised to follow a prevention and rehabilitation program, despite the compelling evidence from randomized controlled trials for the benefits of these programs. And as you know, these programs help patients to change their lifestyle and to control their risk factors and adhere with medications. And all of this is life-saving. And yet, despite that, just half of the patients are advised to join such services, which means that given that 80% of patients actually do so, so the problem is not with the patients. If advised, they are, for the most part, willing to do so. The problem lies with the provision of such services. But given that about half are advised to do so and 80% take it up, that means that only 40% of the entire coronary patient population actually benefit from such programs. And there is enormous heterogeneity in service provision between European countries, and that's not just to do with health economies. Even wealthy countries have the same variation in service provision. So we have a professional and cultural attitude here which needs to change, and we need to encourage the provision of such services and for our patients to attend such programs to get the life-saving benefits.
So thank you so much again, Dr. Wood, for being with us today and sharing your insights about the EUROSPIRE 4 survey results. And I hope you will all visit this community frequently for ongoing information about cardiometabolic disease. Again, this is Nathan Wong for the CardioSource Clinical Community on Cardiometabolic Disease.